Hey there, I'm Joe Carter. If you've ever popped the hood and thought, where do I even start? You're in good company. Around here, we take the mystery out of car repair, one fix at a time. Whether you're a beginner or just looking to sharpen your skills, there's something here for you. Don't forget to like the video and subscribe if you're into learning without the headaches. All right, that's enough from me. Let's get into it.
Hemostatic tourniquet, 1. Set of sterile bandages, 5. Set of non-sterile bandages, 5. Sterile gauze wipes, 1 pack. Sterile dressing bag, 1. Adhesive bactericidal patch 160 by 40, 2. Adhesive bactericidal patch 72 by 19, 10. 1 cm wide tape bandage, 1 roll, 250 centimeters. Mouthpiece for performing mouth-to-mouth breathing, 1. Hygienic gloves, 1. Scissors, 1. Instructions for use of the first aid kit and its contents. The first aid kit is completely devoid of medicines due to special storage requirements, which is impossible to achieve in the conditions of the car trunk. In addition, it is practically impossible to determine the necessity and dosage of a drug without special education. The number of styptic agents has been increased. After all, according to statistics, most of the deaths in road accidents occur due to blood loss. The developers took into account the experience of many countries around the world, where first aid kits have long been completed in this way. As a result, the shelf life has significantly increased from 1.5 years before to 4.5 years now. Additional equipment. The list of drugs in the first aid kit is advisory. But no one will penalize the driver for the presence in it of various drugs in excess of the norm. Each car owner is free to supplement the first aid kit at his discretion. Most often, drugs are reported taking into account the peculiarities of their organism. From other additions, it is desirable to put in the car one more rubber harness, bought separately from the set. The thing is that the standard tourniquet tends to tear, especially when trying to stop the blood in case of a thigh injury. You can also put in the first aid kit special anti-burn bandages. In addition, it is desirable to add anesthetics. The most effective drugs are Boralgin ampoules with syringes. Nimesulide. These drugs are well tolerated both cold and strong heat, while retaining all their characteristics. Such a composition of the car first aid kit will be optimal. Acquisition. Car first aid kit now does not affect the passage of technical inspection, but the traffic police inspector can fine you on the road for its absence for 500 rubles. This is approximately equal to the cost of the first aid kit. And since you can be checked more than once in 4.5 years, it is cheaper to buy it. The minimum cost of such a set is 350 rubles, but experts recommend not to save money and buy a little more expensive first aid kits. The quality of their contents is higher. It is not recommended to buy them at a price of less than 300 rubles. This is a clear counterfeit and, if necessary, it will not be possible to provide assistance with such a set. Buy car first aid kits can be purchased in various places. Pharmacy, gas station, auto parts store. The best option is to buy from a licensed pharmacy chain or a large auto store. Usually, they monitor the quality of the goods offered there. Gas stations are the most unfortunate place for such a purchase. There you can meet a lot of fakes. Therefore, shop there only if you need a first aid kit on the road. First aid. It is not enough to put a first aid kit in the car, you need to know how to use it. In driving, schools teach the basics of first aid. But in fact, this process is limited to a simple study of questions from the tickets devoted to this topic. Therefore, the driver who witnessed the accident is most often unable to properly assist the injured, or in general, refuses to do so. According to statistics, 70% of those killed on the roads die because of the provision of unskilled assistance or its complete absence. At the same time, the modern composition of the car first aid kit allows you to help victims quite effectively. If you have witnessed an accident with victims, you need to adhere to a certain algorithm of actions to protect the place of the accident. Stop the impact of negative factors on the victim. Call emergency services. Provide first aid. The last points may be interchanged. For example, if there is major bleeding, you should first apply a tourniquet and then call an ambulance. In any accident, there is a risk of the car catching fire. Therefore, the first thing to do is to de-energize the car's systems. To do this, simply remove the terminals from the battery. This is a very important action. After all, the car burns for 5 minutes. If a fire occurs, you simply will not have time to pull the victim out of the cabin. There is also a risk of explosion. In such a case, you yourself can suffer. After that, the victim should be pulled out. First, the airbag, if any, is removed and the belts are unbuckled. The condition of the person is assessed. If he is unconscious, you should shine a flashlight into his eyes. Lack of reaction to light is a sign of coma or clinical death. Pull the victim out carefully by taking him by the armpits. If the leg or arm is stuck, you should not try to free it yourself. This may aggravate the injury. It is necessary to wait for specialists from the Ministry of Emergency Situations. When pulling out the victim, it is desirable not to bend the torso and limbs, so as not to cause displacement of bones in fractures. If a spinal cord injury is suspected, the person is placed on the stomach. In other cases, it is advisable to lay on the side. Also, do not forget to remove, tear off, all constricting and interfering with breathing clothes. Stopping bleeding. Start by stopping the bleeding. If the veins and arteries are not damaged, you can do with a simple pressure dressing. If the bleeding is severe and the blood flows out in a pulsating stream, a rubber tourniquet should be used. It should be applied 5 centimeters above the wound. If possible, the limb is raised above the level of the heart. Do not apply the tourniquet directly to the skin. It should only be done by placing a cloth under it or over the clothing. Do not forget to put a note under the tourniquet with the time of its application. Every 1.5 to 2 hours, loosen the tourniquet for a few minutes. Resuscitation. If the victim is in serious condition, resuscitation may be necessary. In the absence of pulse and respiration, first of all it is necessary to free the airways. After that, using a special device, artificial respiration is done mouth to mouth. This action should be interspersed with indirect cardiac massage. When performing one-on-one resuscitation, there should be 15 chest compressions per 2 breaths. When performing resuscitation procedures with 2 people, there should be 5 pressures per breath. Cardiac massage should be carried out until the heartbeat and independent breathing are restored. The person should not be allowed to move independently. To transfer him to the car, it is better to use a stretcher. You can make them from improvised means. There are peculiarities of transportation depending on the type of injury. When fainting, the victim is laid down, making sure that the head is below the torso. In conclusion, having a well-stocked car first aid kit is essential for every driver, as it can be a lifesaver in emergencies, whether during repairs or in the event of a traffic accident. However, simply having the kit is not enough. Understanding its contents and knowing how to use each item effectively is crucial. Take the time to familiarize yourself with your first aid kit and consider taking a basic first aid course. Being prepared can make all the difference when it matters most. Stay safe on the road and ensure you are ready to respond to any situation.